Hello everyone, happy evening, a very good evening. Am I audible and visible, everyone? All right, that's great. So I hope and I believe all of you are doing well, guys, and welcome to the today's YouTube live session where we are going to discuss a topic from First Aid USMLE book. Right, everybody keeps saying about that you should do first aid irrespective of whatever exam you're preparing for, whether it's NEET PG, it's INICT, or even for FMG, right? But when you basically start reading that book, you realize that it's very consolidated book, and many students find it difficult to understand. So that's the very reason that we have these sessions called FAST, which is First Aid Simplified Teaching. So I try to simplify these topics, complex topics from first aid for you, right? This is not the first session that we are having in the FAST series. We have approximately like 13 previous videos that are already available in the Medsynapse app. You can check that out, right? So this is the list of the topics that we have already done from first aid. These are the topics from physiology, high altitude, glomerulus changes, baroreceptor 1. From pharmac, we have done antiviral, anti-cancer drugs. These are the must-watch videos in neurology section, where you have spinal cord lesions, stroke localization. All of this has been discussed with the tricks. Another must-watch video, bleeding disorders, very important. Bone tumors, neurocutaneous syndromes, and the biostats part from PSM. Right, so these videos, the Medsynapse app subscribers, you'll already find it along with the PDFs blank and annotated in the Medsynapse app. There's a separate folder, which is the FAST folder. You can check out those videos from there, right? Somebody who wants to read these topics from first aid, right? So this is the next topic that we are doing, neurotransmitter changes with disease. What happens in Alzheimer's, what happens in Huntington's chorea, depression, anxiety, right? What neurotransmitter decreases and what increases, right? This is one of the most frequently requested topics, and that's the reason that we are doing that. Okay. And guys, if there is any other topic from the first aid that you are struggling with, please do let me know, the suggestions for the next session, so that I'll take it up for the next upcoming sessions. So, right, this video along with the PDF will also be available in the Medsynapse app as well. Okay. So let's start discussing this topic, right, that is basically neurotransmitter changes with disease. You would find it in your first aid book as well, right? So you can see that again that this is one table in the first aid book, but it has so much of information and there are so many potential questions that can be asked from this one particular table. Okay. Hi, good evening, everyone. I can see, my frequent live classes while students here. We have Nirday, Mansa, right? Everybody. Hi, everyone. Arpit also is here. Great to see you all here, right? So let's quickly discuss this topic here, and I'll simplify this for you so that you will never forget that how to remember the neurotransmitters, right? So what you need to learn first is these are the neurotransmitters that you have here, right? And you need to know the location, from where are they coming, where are they synthesized, and what happens to the neurotransmitters in the various disorders. Okay, so this is what we have to learn here. So first, let's focus on the location. Okay, where are they synthesized? So location for acetylcholine, remember it is basal nucleus of Maynard. This has been asked in your exam as well previously. So how do you remember is A ke baad aata hai B. Remember, acetylcholine is basal nucleus of Maynard, and this is basically in the forebrain. Okay, the basal complex in the forebrain. That is where you have acetylcholine. Remember, alphabet A comes in the front, in the forefront. So acetylcholine is in the forebrain. Okay, that's in the forebrain. Next is dopamine. We all know about dopamine, that dopamine is affected, is decreased in Parkinson's disease, and Parkinson's is a problem in substantia nigra. Right, so the synthesis, the site is going to be substantia nigra, right? But remember that what part of substantia nigra? Is it SNPR or SNPC? Pars reticulator or pars compacta? Remember, it is compacta. Okay, SNC, that is substantia nigra pars compacta, that is affected. And this is basically a part in the midbrain. Remember, nigra means black, the black part that you see in the midbrain, that is substantia nigra. Okay, the ventral tegmentum part of the midbrain. Then you have GABA. Now again, if you have watched the short videos on the Medsynapse app, you know that when we have discussed this basal ganglia circuit, everywhere we have spoken about this neurotransmitter in the basal ganglia circuit. What is that neurotransmitter? That is GABA. Right, so in the basal ganglia, nucleus accumbens is where you have GABA being synthesized. So remember, basal ganglia is GABA. So all the Medsynapse app subscribers, tell me that what are the two sites in the basal ganglia circuit where you have basically not GABA but glutamate. Okay, important question कि glutamate कहाँ पे आता है in the basal ganglia circuit? What is the trick for that to remember for glutamate in the basal ganglia? Yes, guys. Glutamate. At what site in the basal ganglia circuit? I hope you remember that story of going into a new city, the toll naka, reaching to the destination, and you have a direct wala rasta, indirect wala rasta, right? Very good, Shiravali. Subthalamus, very good. And which is the other one? Output from where basically has glutamate as a neurotransmitter in the basal ganglia, rest everywhere generally it is GABA. The trick to remember that was glutamate. TA is TA. Remember TA wala, that is thalamus. Okay, we write it as thalamus to remember, and subthalamus. Okay, thalamus and subthalamus. The output from here basically has glutamate as the neurotransmitter. Otherwise, most of the places it is GABA. Okay, so GABA is in the basal ganglia. Then you have norepinephrine. Remember norepinephrine, REER, which is locus ceruleus. Again, this is one of a frequently asked question. Locus ceruleus, REER. Okay, remember this is going to be for locus ceruleus is for norepinephrine. This is present in the pons. Okay, this is present in the pons. Remember norepinephrine, ceruleus in the pons. Okay, NCP, National Congress Party wala yaad rakhna, NCP, it is present in the pons. Then you have serotonin is raphe nucleus, which is present here in the brain stem. So remember serotonin, S for S, coming from the brain stem. And it is what nucleus? Raphe nucleus. So remember again alphabetically R and S. Like AB, acetylcholine was basal nucleus. So raphe nucleus is serotonin, R and S. PQRS, R and S go alphabetically together. Right? So I hope the site is clear with everyone. The site of synthesis easy to remember. हमने mnemonics देखे. A is B, acetylcholine is basalis, RS, raphe is serotonin. Then we have seen dopamine, we all know is Parkinson's, substantia nigra pars compacta, right? और कौन सा देखा? Norepinephrine, RE वाला is ER, ceruleus in the pons. Okay, ceruleus in the pons. That is what we have seen. GABA, we have seen GABA. Remember GABA, BA, that is in the basal ganglia circuit. Nucleus accumbens is where you have the GABA, where it is synthesized. Okay, so the site of synthesis is done. Everybody is clear with this? Oh, is there any issue with the audio video? I don't know. Am I audible and visible, everyone? Okay, thankfully for someone it is in sync. Chalo. A quick thumbs up if this is done with everyone, the site of synthesis. Now we will move on to the next part, that is what happens to this neurotransmitters in the various diseases. Okay, what happens with the neurotransmitter in various diseases. Now first, and the one which everybody should know, it's a must know, is in Alzheimer's disease. What neurotransmitter is affected? Remember, Alzheimer's is AL, that means the acetylcholine is low. Very, very important. Okay, so AL in Alzheimer's, acetylcholine becomes low. Right, so that is what you see here in Alzheimer's. The acetylcholine is low in Alzheimer's. That is the neurotransmitter change that you are seeing in Alzheimer's. Clear with everyone? Okay. Then you have the trick for Huntington's disease. Huntington's chorea. Tell me quickly, what are the 3 M's in the manifestations of Huntington's? Medsynapse app subscribers again, short. What are the 3 M's in the manifestations of Huntington's? 3 M's. Memory, mood, and movement, right? Memory is affected, there's dementia, early onset, then there is mood, aggressive patient, right? Personality problem, aggression is there. And then you have the next one, which is movement. There's abnormal movement, that is chorea, which is there. And in Huntington's chorea, what is affected? Chorea, C for caudate. Okay, there's caudate atrophy, right? And what is the trinucleotide repeat? Remember, Huntington goes for hunting in a boxcar, puts the animal in the cage. Cage is CAGE. So it is CAG repeat. Very good. It is memory, mood, and movement. So remember, it is CAG repeat which is there in Huntington's chorea. CAG repeat. And CAG is what you have to remember here. Look at what is decreasing in Huntington's is acetylcholine and GABA. Okay, so for Huntington's, remember CAG. That means C for caudate is affected, acetylcholine is affected, GABA is affected. All of them are decreasing. Caudate is getting atrophied, acetylcholine is decreasing, GABA is decreasing. Okay, clear with everyone? So remember, this is what is happening in Huntington's chorea. What is happening to dopamine in Huntington's chorea? It is increasing. So remember these points for acetylcholine and dopamine. Imagine like acetylcholine and dopamine are on a seesaw. Okay. So if acetylcholine is going low, dopamine increases. If dopamine is going low, acetylcholine increases. Right. So this is what you are seeing here. When acetylcholine is decreasing, okay, dopamine is increasing, like in Huntington's. Opposite is happening in Parkinson's disease. Parkinson's, you all know that dopamine decreases, right? Dopamine decreases, so acetylcholine is increasing. They are like a seesaw. And that's the very reason that what is the drug of choice that you have in drug-induced Parkinsonism? So you would realize with these sessions that we have that everything is interrelated, right? You learn it in an integrated manner. You don't have to mug up anything. What is the drug of choice in drug-induced Parkinson's? Yes? What is the drug of choice? Right? It is centrally acting anticholinergic drugs. Right? That is trihexyphenidyl, which is there. Very good. Okay. It is anticholinergic drugs. Anticholinergic drugs. Why? Because acetylcholine is increasing in Parkinson's. So you give anticholinergic drugs in drug-induced Parkinsonism. Okay, benzhexol, and trihexyphenidyl. Okay, so remember this is what you have learned here. So basically we have learned Alzheimer's is acetylcholine low. We have learned in CAG, Huntington's, it is caudate, acetylcholine GABA, which is low. Acetylcholine is low, so dopamine increases. Opposite in Parkinson's, dopamine is low, so acetylcholine increases. Okay, so we are done with this part here basically, right? Now coming to the next one, what is happening in schizophrenia, in depression, and in anxiety? First, let's have a look at what is happening in depression. So tell me, what drugs do you read about in depression? What drugs do we give? Yes? Levodopa is not the drug of choice in drug-induced Parkinsonism. Only in Parkinsonism, if they ask, then it is levodopa. But for drug-induced, where the dopamine receptors are already occupied by the drugs, right? They are antagonizing dopamine receptors. You do not give levodopa, but anticholinergic drugs. Okay, that is the concept there. Very good, Shiravali. You read about SSRIs, right? You read about SNRIs. So what are the drugs that we use in depression are SSRIs, SNRIs. Basically these SSRIs and SNRIs, what do they do to the serotonin levels? It is selective serotonin reuptake inhibitor. So by preventing the reuptake, inhibiting the reuptake, they are increasing the acetylcholine, the serotonin levels. right? So basically in treating depression, we want to increase the serotonin. So from there you can derive that what is happening in depression is serotonin is decreasing, norepinephrine is decreasing. So you are giving SNRI, you are giving SSRIs in treatment, right? Serotonin is decreasing, norepinephrine is decreasing, dopamine is the feel good hormone. In depression, the patient does not feel good. That means the dopamine is also decreasing, right? Which is the drug in depression, guys, which acts on this dopamine reuptake? There's one drug. We have discussed all of this in short, right? Antidepressants में discuss किया है. तो मुझे बताओ कौन सा drug है जो dopamine reuptake पे act करता है? What is that drug acting on dopamine reuptake? Right? Which helps in smoking cessation. पियो नहीं, बीड़ी सिगरेट पियो नहीं, pion, that is bupropion, right? So it is your NDRI which is there, dopamine wala hai. So dopamine, norepinephrine, serotonin, all of them are decreasing. All of them are decreasing in depression, right? Clear with everyone? Okay. Now going to schizophrenia, what is happening in schizophrenia is dopamine is increasing, right? Myra, do not confuse bupropion with buspirone. Buspirone is anxiolytic. Okay, bus karo, right? So that is your anxiolytic. In schizophrenia, the dopamine is more, right? The feel-good hormone is more, and that is why the patient is on a high. That means there is psychosis which is developing. Schizophrenia is like a psychosis. So remember, psychosis, patient on a high. So remember, the dopamine levels are increasing. So in schizophrenia, basically you have these antipsychotics which are given, which act on what receptors? The dopamine receptors, because you want to block that dopamine, the high dopamine which is acting, right? So you give antipsychotics basically which are acting on that dopamine. So the dopamine is high in schizophrenia, high dopamine in schizophrenia, right? This is also done. Now coming to anxiety, look at what is increasing in anxiety. Norepinephrine, right? Easy to remember. Anxiety, imagine like that sympathetic system is getting stimulated, so norepinephrine is increasing, right? So remember, norepinephrine is increasing, GABA and serotonin are decreasing. In anxiety, there is elevated excess of norepinephrine, right? Sympathetic system बढ़ जाता है, ठीक है? Done with this table? Easy, everyone, right? So let's quickly revise how and what did we learn in the various neurotransmitter changes in the diseases. So first we started with Alzheimer's, quickly revising the summary. Guys, this is what you have to do when you're watching any video, okay, whether on the Medsynapse app or any other app. When you're watching the video, after like watching 15 minutes, 30 minutes, take a pause and try to make that one-page notes of whatever you learned out of those 15 to 30 minutes. Okay, that is how you'll remember. Otherwise, what happens is at the end of the video, you will feel that kuch yaad hi nahi hai, kya dekha aur kya suna, right? So this is how you remember. So Alzheimer's is AL, it is acetylcholine low. Okay. The next you have is Parkinson's and Huntington's chorea, right? Huntington's chorea, we said it is CAG, repeat. CAG is caudate, acetylcholine, GABA, everything is decreasing. Acetylcholine decreasing, so dopamine is increasing. Opposite in Parkinson's, dopamine decreasing, acetylcholine increasing, right? Next, we spoke about depression. In depression, we give SSRIs, SNRIs, NDRIs. So basically, serotonin, norepinephrine, dopamine, everything is decreasing. Okay, and that is why we want to increase it. Then you have schizophrenia, which is psychosis, right? So there, the dopamine level is increasing. Then you have anxiety. Anxiety, sympathetic system stimulation, you have norepinephrine increasing, GABA and serotonin is decreasing, right? Another important point, remember that what happens in delirium or mania, right? Delirium is the acute disoriented state, classically like they give you ICU में काफी common है. So delirium or mania में क्या होता है? Again, the patient is in a high state, basically means the dopamine is going to be high. Okay, the dopamine is going to be high in delirium or in mania. Okay, the dopamine is going to be high, right? So this was about the quick summary of your neurotransmitter changes in disease. I hope this is now easy. The table which seemed very confusing and intriguing at the onset, all right, I hope it's now easy, right? Like I said, the rest of your fast videos, there are 13 videos we have done so far, all important topics you can watch in the Medsynapse app. This also I'll upload with the blank and annotated PDF both in the app. In the fast folder, it's going to be there, right? And you know, these for whoever has any query related to Medsynapse app, guys, you can reach out on the numbers here, or you can also WhatsApp on 9922882189. Okay, and these are the various plans that we have. The next live session that we have upcoming on the Medsynapse app, the KBMD, Kaun Banega MD live MCQ discussion. A quick correction here, PSM we are going to have on 10th of February instead of 8th of February, right? So the next session that we have, live session on Medsynapse app, it's going to be on 10th of February for PSM. Okay, right? So that was about a quick fast session here, guys. If you have Nirday, I know that, you know, it's like ye dil mange more, right? But this was like a quick you know, quick productive break for you guys in your daily target. I hope it was productive. We'll keep meeting for more such surprise sessions, whether be it on YouTube or on the Medsynapse app. And please keep following the timetable, that the entire cycle, the daily targets that I've given you for NEET PG, also for FMG students, we have started from yesterday, 3rd of February, right? Please follow the timetable, get everything at one place. Time and again, I'm telling you about that. Your first the cycle that you are doing now is basically focusing on getting everything at one place. Okay. So if you have any other suggestions in the first aid book, there's any topic, any table that you are struggling with, please do let me know. We'll discuss it together, right? So that we learn it together in an easy way. Okay. All right. Okay, Dr. Nishant, I'll try to do as much as I can, definitely. Okay. Thank you so much, everyone, guys. Have a great day. And like always, keep studying, keep revising, keep medsynapsing, and keep winning. Thank you so much, and see you again soon. Thank you.